Ron Hoppe, CEO of WorldWide HealthStaff Solutions, and I'm excited to be here this morning to share with you a very special International Nurses Day celebration that we have planned. I'd like to introduce Ms. Beth Vanderwalker. Beth is our Vice President of Operations. And Beth, please share with the nurses around the world what we have in mind.
There has never been a more important time to celebrate International Nurses Day than 2020. We here at WorldWide HealthStaff Solutions really wanted to do something very special to be able to help as many nurses as possible pursue their American dream. You are invited to be a part of an online International Nurses Day celebration where health staff will introduce and provide Nclex prep training. Regina Callion, President and CEO of ReMar Review, will share a clinical review module for free and share how ReMar Review students pass Nclex generally on the first time. As a nurse myself, I know how vital prep materials were in me passing the Nclex exam, and we feel these materials will help you as well. International Nurses Day is a day where we want to celebrate you and a day where you can begin to invest in yourself and for your future for not just you, but your family as well. We look forward to having you join us. You can find all the registration details in the description below. Again, thank you for all the work that you do on a daily basis during the Year of the Nurse, and happy International Nurses Day.
We are celebrating your future. That's right. And if you were wondering, my name is Regina Callion of ReMar Review, the founder, the Nclex instructor. I have been educating international nurses for over 10 years. And so it's truly my pleasure to be here with you today as part of our WorldWide HealthStaff Solutions and ReMar Review family. We are here to show you that we are going to hold your hand every step of the way. We want you not only to pass your Nclex, but get that job of your dreams, that direct hire placement. Yes, you can have it. This is your year to have the nursing career of your dreams. We're going to help you to do it. So we're going to get started with the Nclex review because that's the first step to working. You got to pass your Nclex exam. And I'm going to tell you more about your situation so that at the end of this review, you're going to feel more confident. But what I need you to do now, hey, get out that workbook. That's right. We're going to be working from your downloadable PDF International Nurses Day workbook. So you really want to have it to take effective notes. Now, if you are an international nurse, you may or may not know these statistics, but I just want to share some information with you. You know, the top 5 countries that represent international nurses who take Nclex are traditionally from the Philippines, India, Puerto Rico, South Korea, and different parts of Africa, particularly Nigeria. So one of these may be your home countries, but what we see in terms of who passes Nclex, you know, when it comes to our internationally educated nurses, about 40,000 take the Nclex RN exam. About 1,300 take the Nclex PN exam. But as you can see, the passing rates there are not very good, okay? So on average, there is a 36% passing rate. So that means that 63% of nurses who take this exam do not pass it. All right. And so that's why we're here to show you that we're different. We are going to help you to overcome the statistics. We want to make sure that you are passing this exam on your first time. Now, you may have never seen this number before, and you're asking yourself, why are international nurses struggling with this exam? Well, you know your own personal struggles, but in my experience, I think some of the other contributing factors are this. When it comes to studying for your Nclex exam, there's just a lot of information, right? There's a ton of nursing information that you need to know. Language is also a barrier. And so other Nclex reviews may give you complicated, long medical jargon, and it's very tough to study that way. And then, of course, the costs are very high. When you want to come to the US, it's very high. The testing, the prep, and just the general lack of support. So this event was for you. This event was to show you that in our family, we do things differently. All right. And how I'm going to help, I'm going to focus on that content. I'm going to tell you exactly what you need to study and nothing else. All right. I'm going to use simple terms. I'm going to break this information down so that at the end of the review, you come out saying, I feel so much better. Our prices, we keep our prices affordable at ReMar, and we have that community. Every year, we help thousands of international nurses pass their Nclex exam. And so I'm very proud right now in our virtual trainer, there is about 6,800 nursing students all studying together. So you talk about a community, we have it. And they all have the study groups, the community discussions. It's just a beautiful thing. One of my favorite parts about helping international nurses is the stories that I get to hear. Here's one of my favorite.
Hi to everyone. I am glad to share to you the good news that I have taken and passed my Nclex RN examination last February 10, 2020. A little background about myself. I am Marie and I am a foreign nurse in the Philippines. I graduated 12 years ago. English is not my first language. I'm a repeat test taker. I have used a lot of Nclex materials and resources before, but it didn't really help me to pass the exam. With the VT, gives me accountability. That's what I like about it. I give myself 6 weeks. I followed Miss Regina's calendar, the 6 weeks, and I just added 2 weeks more for practicing questions. I took the exam and I passed it. I thank God so much for this, for answering my prayers to help our fellow nurses. If I can, I will, and I did pass Nclex, and so you will. God bless everyone. Bye.
Everyone has a story, but at the end of your story, no matter how different our journeys may be, we want to end up with our nursing license. So in today's class, we have a couple things that we need to cover, and so this is what it is. Honestly, I'm going to give you some information. This information is going to help you to understand the things that you already probably are familiar with, but we're going to bring it together. I want you to give me 110%. That means no distractions. That means take this class serious. This is an opportunity. My program was designed for students like you. All right. So if you do your part, I'm going to do my part. We're going to work together to make this a successful study session. Again, get out your workbooks. They're downloadable. You need to have them because we're going to jump right into it. One thing about studying for Nclex is that it's a marathon. It's not a sprint. And so if we use our time effectively, then we can make progress. Now, I love talking about the subjects for this study session because if you get a great foundation of content down, then you have a house that can stand during the Nclex. And so we're going to talk about diabetes mellitus. Diabetes mellitus, we hear it all the time, but do we actually know it? Do we actually know what's important for a licensure examination? All right, so let's fill out the blanks here. If you're on the diabetes mellitus page, well, what is diabetes mellitus? Diabetes mellitus, and you're filling this out, it is a metabolism disorder in which the blood glucose levels are too high. The blood glucose levels are too high. And I want to just stay here for 1 second. And I want to talk about these terms here, diabetes and mellitus. Diabetes and mellitus, because what I found as a nurse is that clinically, these names have significant meanings. And if we understand the terminology, if we understand the language of medicine, the language of nursing, oh my goodness, it's going to help us so much in our learning process. So let's just look at the term diabetes. When you see the word diabetes, what does that mean? Clinically, what does that mean? And I know I can just hear you. I can just hear you right now. You're saying diabetes means high blood sugar, right? Diabetes means high blood sugar. But actually, that is incorrect. That is not what diabetes means. When you see the term diabetes, I want you to write this down. Diabetes, and you can write it down anywhere on your paper. This is just for your additional knowledge. This is how you study. Diabetes means a client, all right, who is putting out a lot of urine. So when you see the term diabetes, I don't want you to think about blood sugar right now. I want you to think about somebody who is putting out a lot of urine. That is what the diabetic does. So the term diabetes means somebody who's putting out a lot of urine. Mellitus is the term that you see after diabetes here. Mellitus means what? If something is mellitus, what is that? That means it is urine that is sweet tasting. Mellitus is sweet tasting, sweet smelling, because they used to drink urine, right, to determine what kind of issues a patient had, right? So the term mellitus describes the urine. The mellitus describes the diabetes. So I hope you're tracking with me. So this lets us know that a patient has high blood sugar. But we have to be very careful because there are other conditions that use the term diabetes that has nothing to do with blood sugar. For example, diabetes insipidus. Okay. Have you heard of diabetes insipidus? We're not going to get into that today, but if you have diabetes insipidus, you're putting out a lot of urine, but your blood sugar is not high. So we want to make sure when we're studying, we're really getting to the important points. So here we are talking about the metabolism disorder in which the blood glucose levels are too high. So on your worksheet there, what is a normal blood sugar range? What should our client's blood sugar be? What are we expecting it to be? Go ahead and think about it. I'm going to show you the answer. We're expecting it to be about 70 to 110. All right. And so this is the range that we like to see our patients in. Now, there are two types of diabetes mellitus. You guys are probably familiar with this. So let's break down the structure of each one. Now, we have a type 1, okay, diabetes mellitus, and then we have diabetes mellitus type 2. And it's important to know the pathophysiology between the two because they are different. Even though the treatments might be similar, what is happening in the patient's body is very different. So let's look at the first category here. So if we're talking about diabetes mellitus type 1 and type 2, we need to know the age, right? So the age. For type 1, just fill in that box there. It's very simple. If you are a type 1 diabetic, you are generally a child. This is something that we see in what they call it juvenile, right? Juvenile diabetes. We typically see this in children. Type 2, you are an adult, okay? Normally, clients tend to be grown-ups. They're adults. So the question is, with diabetes mellitus, it's very important for the body. Is the body producing insulin? And I have there the answer for you. So with the type 1 diabetic, the body is not producing insulin. And so this is a major difference between type 1 and type 2, because the type 2 diabetic, there is still some insulin production. There's still some insulin production. So knowing that, it brings us to our next question. Insulin dependent. What about the type 2 diabetic? What do you guys think? So let's think about it. For the type 1 diabetic, if the body is not producing insulin, will those clients need to get an outside source of insulin? If the body doesn't have insulin, can you live without not producing insulin? Absolutely not. Type 1 diabetes is very dangerous. It is important that these clients do have insulin. They are always insulin dependent for the rest of their life. Actually, if a client with type 1 diabetes does not get insulin within about 3 months after their diagnosis, they will die. They will die. And so it's very important for us as nurses to be able to tell our patients, no matter how young they are, 9 years old, 10 years old, we have to tell them this insulin is going to save your life. All right. So this is the things that the board exam, they want you to be able to demonstrate competency in. Do you know the basic differences between type 1 and type 2 diabetes? All right. So we know that answer, insulin dependent for type 1, yes. For type 2, no, not always. Not always. All right. Because there is some insulin production there. Another safety question that I always see about diabetes mellitus is this: will there be ketone production? Some of you may be thinking, oh my goodness, what is ketones? What should I see ketones in type 1 or type 2? All right. Remember, type 1 diabetics have the ketones. Type 2 diabetics, no, not so much. Not so much. And I can't go on without reviewing, where do ketones come from? Because we hear it, we know it commonly. You can get ketones in the urine, but actually what's happening with ketone production? So remember, when your body doesn't have enough insulin, it will begin to use what for energy? It will begin to use fat. Your body will begin to burn fat. And so we see this in the type 1 diabetic. And some people think, well, isn't fat good? Isn't it good to burn fat? We want to burn fat, but not on the cellular level, all right? The cells do not like to use fat for energy. And so when they do, a poison is created, right? Ketone is nothing but a poison, right? So that's where you see the ketosis. That's where you see the patients having complications. We don't like ketones. And normally, because there's such a lack of insulin, the type 1 diabetics do suffer from having ketone production, but the type 2 diabetics do not normally, okay? So what is the treatment for type 1 diabetes? What is the treatment for type 2 diabetes? You guys may be interested to know that the treatment is pretty much the same. So for the type 1 diabetic, what we teach the client is this: to modify their diet. Yes, when you have diabetes mellitus, you have to follow a very strict diet. It's important. Okay. And that's the same for type 1 and type 2. So go ahead and put that in both boxes. Modified diet. Okay. You have to change your diet. You have to eat healthy. Now let's continue to look at the type 1 diabetic. Not only will we have to modify their diet, but as we talked about earlier, you are going to have to add insulin. This patient will not produce insulin on their own, so we are going to have to add insulin. And exercise. I love exercise for the diabetic client because what does exercise do to the blood sugar levels? What do you guys think? What do you guys think exercise does for the blood sugar levels? Absolutely. Exercise will lower your blood sugar naturally. It'll lower your blood sugar naturally. So exercise is always included as part of a healthy blood glucose management plan. Okay, let's go to the type 2 diabetic. We already talked about changing the diet. Instead of insulin, most type 2 diabetics they take the oral anti-diabetic medications or drugs. So they start actually on the pills. And I can't wait for you guys to get into the virtual trainer so that we can go more into detail about those specific medications. And then we already know about exercise. All right. So as you guys can see, when we study together, the goal is not for me to spend hours and hours explaining, everything about diabetes, but it's for us to really focus in on those major points of safety that will be on your exam. And so that's what makes our studying sessions so effective, is because we get right into what's important. So coming up here now, we have what are the signs of diabetes mellitus. We got to know the clinical signs and symptoms. These are very common. We know them as the 3 Ps. Let's say them together: polyuria, polydipsia, and polyphagia. Yes, these are the 3 famous Ps of diabetes, but we're not going to just write them down. Let's define them together. So when you talk about poly, we know it's too much. So the first term, polyuria, means too much what? Too much urine. Yes, so we talked about that. That's what a diabetic does. They put out a lot of urine. So you have another term that describes putting out a lot of urine, polyuria. Polydipsia means that our client will report what? What will they say? They will say, hey, I am thirsty. Polyuria, I am thirsty all the time. And polydipsia follows right along with that. The diabetic client, diabetes mellitus in particular, will say, I am hungry. So polyphagia means the client has an increased hunger. So these are the clinical signs. There is also another exam that you can do that I want you to know specifically for the Nclex, and that is a blood test, okay? A blood test, and we call that glycosated hemoglobin, or the short term is Hemoglobin A1c, okay? Now, this is a blood test that looks at blood sugar control over 3 months. Okay, so you want to know that number. This is going to look at your blood sugar control over 3 months, and it should be less than 6.5%. That's our number. That's the number that I like. Some laboratory references may say 7. Some of them may say 7, but 6.5%. And so with the hemoglobin A1c, it's used if a patient has risk factors. They come into, the healthcare provider's office and the doctor isn't sure. So we can do a blood test, the hemoglobin A1c, and we can say, yeah, over the last couple months, your blood glucose levels have been consistently high. So you do in fact have diabetes mellitus type 2, okay, or type 1. So that's the importance of this blood test. But you need to know that it is 3 months and we're looking for a number less than about 6.5%. Okay, so you know what? Let's do a practice question. We did some content review. Now let's do a question. And I love case studies here at ReMar because they help to solidify what you have been studying. So the question is this. A 16-year-old woman is admitted to the critical care unit with severe hyperglycemia caused by new onset type 1 diabetes mellitus. The nurse notes a sweet-smelling odor on the patient's exhaled breath. This is a result of, is it 1, ketoacidosis, 2, hunger, 3, decreased serum osmolarity, or 4, increased protein metabolism. Okay, so we have studied this topic and everybody should know the answer right away. We know that the correct answer is what, ladies and gentlemen? It is number 1, ketoacidosis. Absolutely. Ketones, not only do they come through your urine, but the acid, all right, the acetone, the ketones can come through your breath. And it is a fruity, sweet smell that is demonstrated. And so the reason why I love doing questions after we study the content is because the questions are supposed to come after you study. Imagine if we hadn't studied type 1 diabetes and I just started asking you all of these questions about it. How difficult would it be? It would be quite challenging. And so when you're continuing to study for this test, know that you need to study the subject first and do the questions last. All right. Not the other way around, but we'll get more into that later. Hey, the Nclex RN has a ton of teaching points on it. You have to know how to teach your patient. And so we're going to go over some common teaching right now, diabetes mellitus. And the first topic that we got to talk about is exercise. And when a client with diabetes mellitus begins to exercise, what do we tell them? Well, we're going to tell the client this. Exercise lowers blood glucose levels. That's right. Exercise lowers blood glucose levels. Clients should exercise after meal times. That is the best time to exercise. And they should always let somebody know that they are exercising. Okay. A snack may be required after exercise or before exercise, but they should plan to pack a snack when they exercise. And of course, we have to teach the signs of hyper and hypoglycemia. Hyper and hypoglycemia. So Nclex is a big stickler for education when it comes to exercise and diabetes mellitus. Another point that we have to exercise our another point that we have to teach our diabetic clients, are what to do when they are sick. What happens when your diabetic patient gets sick? So these are the major teaching points. When a client is sick, it raises the blood glucose levels. That's right. Did you know that? Yeah. When you're ill, when you're stressed, when you're sick and you're diabetic, that increases the blood glucose levels. So we have to tell our patients, it's important that you take that insulin. Okay. We have to teach our clients, even if you're not feeling well, you need to keep taking your insulin, because the blood sugars are going to be high. And we have to monitor the blood glucose levels more frequently. Does this make sense to you guys? All right. I want you to see, all right, that these are the major teaching points about this topic. And clients, they have to know, hey, what is the treatment for hyperglycemia? What do I need to do? Because my blood sugar is going to be high. All right. So as we talk about the treatments for hyperglycemia, that moves into our pharmacology review. Yes, ReMar review. I like to cover it all. And so this is a preview of what our full Nclex review will look at. Right now, we're about to get into the insulins. And yes, you cannot study diabetes mellitus and not review the different types of insulin. And so what we're going to go over is the insulin types, We're going to talk about their onset time. You guys know what onset means. We're going to talk about their onset, their peak, and their duration. So again, this is what I love to do, studying with you right now. It's such a good time. We get so much covered when we study together. So the first types of insulin that I want to look at, I want to look at the rapid acting insulin. And you can go ahead and fill out your boxes here. But remember, for Nclex, we need to know the generic names, okay? We need to know the generic names for this exam, no matter if you're taking RN or PN. So we have here insulin Lispro or insulin Aspart. So what is so essential to understand about rapid acting insulin? Well, I think the name tells it all. When you give this medication to a patient, how quickly will it begin? Okay. The onset is less than 15 minutes. So that means you need to give this patient their rapid acting insulin when food is readily available to them. Okay. Because what does insulin do? Is insulin going to raise their blood sugar or lower it? Insulin is going to lower that blood sugar very quickly, the rapid acting insulin. So the patient needs to be eating something. All right. So the onset very quickly. Now the peak of the insulin is when that medication is at its highest, when the medication works most effectively. And the peak of rapid acting insulin is 1 hour. And the duration is 3 hours. The duration is how long the medication lasts. And so rapid acting insulin lasts about 3 hours. And these are the numbers that I want you to remember. Okay. 1 hour, 3 hours, less than 15 minutes. And those are the categories. All right. So very straightforward, simple. This is our first class that we're going to study, the rapid acting insulins. So you know the most important things about them. You know the generic name, you know their onset, their peak, and their duration. Now, the next class of insulins that you need to know, this is our short-acting insulin. I have here, this is that clear insulin. This is the regular insulin. So the generic name will always be Novolin R or something with an R after it. And that R stands for regular. Regular insulin is a short-acting insulin. The onset is about an hour. The peak is 2 hours and the duration is 4 hours. Okay. Onset, peak, and duration. And remember, the regular insulin is always clear. Always clear. Hey, another thing about regular insulin, I don't know if you knew this, but regular insulin is the only insulin that you can give IV. So if a patient is on an insulin drip, they're getting insulin IV, we know that that is always regular insulin. So that is a huge safety point. Regular insulin, always clear, always IV. Okay, let's move on to our next category of insulins, and that is our intermediate insulins. Yes, this is the cloudy insulin. If you're drawing up two types of insulin, it's clear before cloudy. So this is that cloudy insulin. The names are there for you guys. NPH, we can call it isophane suspension. The onset, 4 hours. Peak, 8 hours. Duration, 12 hours. The final category of insulin is insulin that is long acting. And so you have their glargine. All right, that's the generic name. Now the onset is slow. I don't have an onset time specifically. If you do the research, you'll see that it's about 2 to 4 hours. So this is by no means a rapid acting insulin. But the thing about the long acting insulin is that there is no peak. Okay, so that means once it's in the body, it's pretty consistent. And that's important. This is a peakless insulin. and the duration is about 24 hours. Okay. So those are the major points about those categories. Those are the things that Nclex likes to stand out when it comes to the questions that are written. Let's go on. Let's do some more practice questions on this topic. Here is another one, and this is a case study. This is going to pick up from where we left off the first patient. So let's follow her now and let's see what is happening. It says here that 2 days later, the client is stabilized and the healthcare provider orders insulin Lispro 15 units. When should the licensed practical nurse administer this medication? All right, so you guys know that insulin now. So is it number 1, 30 minutes before meals? 2, when the client is eating? 3, 15 minutes before the client begins eating? Or 4, when the meal tray arrives on the unit? So what sayeth you guys about when this patient needs to receive their insulin Lispro? The correct answer, you may have guessed it, but even if you didn't, this is a learning process, is going to be 2. Yeah, when the client is eating, this is the best answer, okay? Because remember, when we have that rapid acting insulin, food should be in front of the patient, okay? Food should be in front of the patient. Now, if you chose number 1, 30 minutes before meals, well, my goodness, that's not going to work. All right, because by the time the patient begins to eat, their blood sugar is going to be way, way low. Okay, again, 3, 15 minutes before the client begins eating. That time is not going to be safe. All right, because the onset of the medication will begin working at 15 minutes. So imagine the blood sugar goes down, okay, at the start of the meal. And then number 4 says when the meal tray arrives on the unit. Well, you guys know, how long can the meal tray be on the unit before it gets to the patient? It just depends on the day or how busy everybody is. So that's not going to be appropriate either. 2 is the best, the safest answer. 2 is the safest answer. Now let's look at another question. Question number 3 right here. It says, during administration of the morning medication, Linda asked the nurse, "Why can't I just take pills?" Which is the best response by the nurse? Okay, so we need to address the patient's question. So is it 1, the type of diabetes that you have needs a fast-acting medication like insulin? 2, I understand what you're saying. This question can best be explained with your diagnosis by the healthcare provider. 3, insulin cannot come in the pill form as it would be destroyed in the stomach acid. Or 4, is there a better way I can teach you about injections to reduce anxiety? So here, what do we need to do to address our client's concern? What is the statement that's going to solve the question? All right. And so if you guys are thinking, it is number 3. Number 3 does that perfectly. Insulin cannot come in the pill form as it would be destroyed in the stomach acid. So this gets to the heart of the patient's concern, and it's going to be best for us here. All right, let's look at number 4. I like this one. All right, I really do. It says, after Linda's evening insulin administration, the nurse finds the client unresponsive. Which is the initial action of the nurse? What's the first action? Is it number 1, notify the healthcare provider for an order to treat the client? 2, assess the client's vital signs. 3, call a code. Or 4, treat the client for hypoglycemia. What do you guys say here? We're actually given a lot of information in the question stem. So the correct answer, I'm going to show you the correct answer, and then we're going to break it down a little bit. So the correct answer is treat the client for hypoglycemia. Why are we going with this? Because if we read the question again, and this is what it is with Nclex, reading is really half the battle. If we read this question again, we find out everything we need to know. So it says, after Linda's evening insulin administration, the nurse finds the client unresponsive. So is it a big mystery why Linda's unresponsive? Do we need to do a CAT scan of her brain? Do we need to check her laboratory values or her oxygen saturation? No, we know that she's unresponsive because she's been given what? She's been given insulin. And so what does insulin do? It lowers your blood glucose levels to the point where, yes, you can get into a coma. You can become unresponsive. And so what's the first thing that needs to happen for Linda? Because Nclex is all about safety. The first thing that needs to happen is she needs to be treated for hypoglycemia. And we don't have to wait to do that. All right. Everybody should be ready to treat hypoglycemia in a client who you have given insulin to. And so if you pick number 1, notify the healthcare provider. Oh, it sounds so good, right? You know, to get an order to treat the client. But if you choose that for Nclex, you are going to be deemed unsafe, because what it's saying again here is that if your patient is unresponsive, you will leave the patient to go call somebody else when you can fix the situation. All right. You call that healthcare provider, he's going to ask you, what did you do for the patient? What has been done for the patient? And you can't say, oh, I didn't do anything. I just called you. That's not going to work. Checking the client's vital signs. If you pick 2, the vital signs will not give you any more information than what you need. All right. So the temperature, the blood pressure, the heart rate doesn't matter. It's the insulin that was given. All right. That's the problem. So we know this patient needs glucagon, IM, right? Or IV if you're RN. And then calling a code is very similar to calling the healthcare provider. Essentially, it's notifying somebody else about your problem. All right. You're the nurse. You need to handle it. Calling the code team is not appropriate when there's something that you can do. So we have to be very careful with these questions, and we have to understand that we take ownership of our patient's outcome as the nurse. Okay. As the nurse, you have to be ready to intervene. And so I really love the next topic that we're about to get into, priority questions, because these are the questions that really help you to demonstrate what management of care looks like. And so we're going to get into priority questions, the who should the nurse see first. But before we do that, I want you to hear more about the amazing job opportunities that are available to you.
I'm Ron Hoppe, CEO of WorldWide HealthStaff Solutions. I hope that you're doing well. I wanted to take a few minutes and just share with you what we see happening for the rest of 2020 when it comes to direct hire international recruitment of nurses from around the world for great positions with U.S. healthcare employers. For more than 2 years now, we have been speaking and educating nurses around the world on the differences between direct hire job opportunities versus staffing agency or travel nurse opportunities. Direct hire job opportunities, like the ones that HealthStaff specializes in, are job opportunities where you, the applicant, is hired directly by one specific hospital for a specific location, and upon your arrival, you will receive the same pay and the same benefits as every other similarly qualified applicant working for that employer. Right from the outset, from the date of your interview, you will know exactly where you will be placed. This obviously allows for you and your family to plan to settle down, for your children to enroll in local schools and make new friends, for you to establish a new home with the security of knowing that in the next 3 months, 6 months, or 12 months, that you're not going to be required to move to some location in the United States over which you may have zero control. The other great advantage of direct hire, and why so many candidates are choosing this opportunity for themselves, is the fact that you will receive the same pay and the same benefits as similarly qualified applicants working for your employer. Why is this important? Do you have the confidence of knowing that if you have 5 years of experience, you will be paid at exactly the same rate as every other nurse working on your department that also has 5 years of experience? You will receive the same benefits in terms of vacation and paid time off, retirement benefits, sick leave benefits, perhaps tuition assistance and others, as every other one of your colleagues working there. Nurses employed by staffing agencies rarely enjoy the same benefits that their colleagues that are working directly for the facility have. The direct hire option is your best option for your future. It gives you the peace of mind from the day that you're interviewed of knowing exactly where you will be located and exactly who your employer will be and exactly what the terms of your employment will be. We invite you, if you have already written and passed the Nclex exam, to contact our recruitment team today. You can very easily reach them at recruiting@healthstaff.org, and one of our experienced recruiters will respond to you within a day, letting you know what opportunities we may currently have available for you. And if we don't have something that meets your exact requirements today, I'm very confident that we'll have that perfect opportunity for you very soon. If you're viewing this today and you've not yet taken the Nclex exam, we have partnered with ReMar Review to offer nurses around the world the best value in Nclex review programs that you're going to find anywhere. We have information on our website at healthstaff.org where you can learn more about this. And we also invite you to contact us via email at nclexprep@healthstaff.org, and we'd be happy to provide you with additional information on how you can get started on Nclex. Whether you've passed the Nclex exam or not, WorldWide HealthStaff Solutions is here for you. We look forward to helping you today, and we look forward to being of service to you tomorrow.
Hi Regina, Mark, and ReMar team. Thank you so much for sending me the book. I love the VT trainer because it's easy to understand and navigating through it. I love the questions. The content are all in one place. Regina, you nailed it again, and thank you for doing this for us. I know in God's hand and with VT, we can, we will, we must pass Nclex. Guys, if you guys haven't got the VT yet, please do so. Regina is having another sale, so grab it before it's too late. God bless and your family. Bye.
The products that I have developed from working with nursing students who are international have been life-changing. And so when you sign up for your virtual trainer, you're going to get your virtual trainer workbook. And this is just a continuation. It's the extended version of our workbook tonight. And so it's all of my lecture notes, my homework, my practice exams for you guys. Also, the other book that I will give you is this book right here. I was reaching for it, is the Quick Facts for Nclex. And this is one of my my flagship products for nursing students, and it breaks everything down so simply for you guys who are studying for Nclex. So I'll have more about that in a little while. Okay, we're going to get right back into it. Who should the nurse see first? I love these questions. These are my favorite types of questions because they're so straightforward, right? You don't have to guess. So what I'm gonna do is we're gonna go over that first question on your workbook. And I just want you to give it your best shot, all right? Just give it your best shot. So it says, based on the report, who should she see first? We're talking about the nurse here. There's a scenario, but at the end of the day, the question is asking you, who should the nurse see first? So is it number one, an 8-year-old client reporting of asthma with no signs of respiratory distress, who was given hydromorphone, 1 milligram IV for acute pain. Okay. Is it 2, 38-year-old client with a severe nosebleed who states his lower back hurts when he lies completely flat in bed? 3, an 83-year-old client with type 2 diabetes mellitus who has a blood glucose level of 325. All right. Or is it number 4, the 59-year-old client with a left lower DVT on a heparin drip who reports pain when walking, Okay. So you guys may have your priority patient. I want you to hold on to it. I want you to circle it, actually. Go ahead and circle it. And then I'm going to tell you how I like to break down these patients. So we're going to fill in the box, okay? And then we'll go back and we'll go over the answer together. I promise. So the first thing I want you to write down is do not get distracted with age or gender, okay? So for me, it doesn't matter how old the patient is. And it doesn't matter if they're a male or a female. I hope that makes sense to you. These are things that you cannot get distracted by. Only think about what is happening right now. It is so easy for us to read into the cases and make it more than what it is. Does anybody have that problem? Or is it just me where you want to go deeper and you want to manifest more symptoms than what is actually there? We gotta stick to reading what is there. All right. Don't read into these cases. And then ultimately we are looking for the client who is going to die first. We're looking for the client who is going to die first. And so this means that this patient is the priority. This is the most unstable patient. The one who's going to die first is the most unstable. All right. This is the person that needs the intervention immediately. So let's go back to the clients that we have and let's just break them down together. So let's start from number 4. Let's work our way up. Number 4, 59-year-old client. Okay. So we don't care about their age, right? It doesn't matter. What is happening with this patient? They have a left lower DVT. Okay. So we all know that's a blood clot in the leg. All right. And it says that they are on what? They're on heparin. Is this an appropriate treatment? Do we expect the client with a DVT to be on heparin? Absolutely, we do. But even with all of that information, right now, what is the patient reporting? What is the issue? The issue is not anything wrong with the heparin drip, right? It's not even necessarily the DVT because it is being treated, all right? The patient says they have what? They have pain when walking. So this is a client that says, I have pain. Is pain a priority? That's what I want to ask you guys. Is pain a priority for client 4? Well, let's think about it. Typically, there are 2 types of pain, right? There's expected pain and there's unexpected pain. So does this client have pain that is out of nowhere, that is new, that is undiagnosed, or is this expected pain? Yeah, this is expected pain. This patient has a DVT. When you have a blood clot in your leg and you are walking, it's painful. So the question is this our priority patient? Can you die from pain? All right. Can you die from pain? Typically, no, you can't. All right. So this patient, if you think about airway breathing or circulation, which is another way I like to look at it, if you think about ABCs, did this patient have an airway breathing or circulation problem? Yeah, this would be considered circulation for this patient. Let's look at 3. 83-year-old client, not really concerned about the age. What is going on? The patient has an abnormal blood sugar level. The blood sugar level is high. It's 325. So with that being said, is this patient going to die quickly? Is this an acute emergency? A blood sugar level of 325. All right, how would we classify this? Airway, breathing, or circulation? So this is another circulatory issue. This involves the blood. All right, I've had patients whose blood sugars have been in the 1400s. All right, so 325 is high, but this patient has a circulatory issue. Let's see if we can find someone who's a little more acute. What about number 2? Now, number 2, you have a 38-year-old client, not really concerned about it, but the client has a severe nosebleed, right? The client with a severe nosebleed, is that airway, breathing, or circulation? That's where I want to ask you guys. So with the nose bleeding, because it's bleeding, it is circulation. Yes, anytime you have blood involved, it's a circulatory issue here. But that's really not the point. What is the patient actually reporting? The patient is actually saying, my back hurts when I lie flat in bed. That's the issue. And so we have a patient with back pain here now, right? And normally, sometimes when you are lying flat in bed with no pillow or anything, your back hurts. So is this our priority patient? I don't think so either. It's actually number 1. Yeah, number 1 is actually our priority patient. You have an 8-year-old, which isn't the major issue at all, but the client is reporting asthma, okay? Asthma, airway, breathing, right? But it says they have no signs of respiratory distress. All right, and that's kind of a distractor because number 1, even if a patient doesn't have any visible signs of respiratory distress, what are they there for? They're there for asthma. So you can have a situation where your asthma has gotten so bad that you have no signs of respiratory distress because the airway is completely closed off. All right. So this is a patient that needs to be seen for the very fact of their diagnosis. Anybody with an airway problem, anybody on a ventilator, these are the patients that you are going to see first. All right. And then it says this. Not only does the patient have some asthma going on, but they were given a opioid or narcotic. All right. And what does that do for respirations? We know that actually depresses respirations. So we need to see about this patient. All right. So I hope us breaking these patients down really help. And this is why I love to work with international students, because we get the ball rolling. Let's do another priority question here. It simply says this: who should the nurse see first? And we have here a 7-month-old female with bulging fontanelles, crying loudly. 2, a 3-year-old male with a temperature of 38.8 Celsius. 3, a 10-year-old female, 48 hours after a tonsillectomy, who is now confused. Or 4, a 9-year-old reporting stomach pain. A 9-year-old reporting stomach pain. Now, knowing what you guys know now about priority questions, who do you want to see first? Everybody should be saying, yes, number 3 is my priority. Number 3 is my priority because this patient has had a surgical procedure 2 days ago, but it says now they are confused. What is going on with your patient? All right. Is this a decreased level of oxygenation? You had a tonsillectomy. Are you not getting enough oxygen? What's causing the confusion? And so I want to go back here just really quickly because some people may have picked number 1, the 7-month-old with bulging fontanelles while crying loudly. All right. And just a reminder that the fontanelles do bulge when a baby is crying, right? Those soft spots do bulge. What we worry about is when they are depressed or when they're sunken in. And that indicates what? What does a sunken in fontanelle indicate? That indicates dehydration. Dehydration. Okay. All right. Let's go to our next question here. It says that immediately after experiencing numbness of the face and an inability to speak and paralysis, okay, the symptoms disappear and the client states they no longer want to be seen. The nurse should include which of the following statements in her client education. Okay, here are the statements. The client has probably experienced a transient ischemic attack, okay, TIA, which is a sign of progressive cerebral vascular disease. 2, the client is not free to leave when the symptoms reflect cerebral involvement. 3, the client has experienced the effects of a thrombus and needs to be treated within 24 hours. Or 4, the client does not have any cardiac issues as the symptoms resolved on their own. Okay. Okay. All right. So here is a little different. All right. But I wanted to do these kind of questions because I want you guys to understand that there is a process that includes many different topics that you need to master for the Nclex exam. So if we're looking here, what do you know about cardiology for Nclex? All right. I love to talk more with you guys about this, but the correct answer here is going to be, yeah, number 1, the client has probably experienced a transient ischemic attack, which is a sign of cerebral vascular disease. Yes, TIAs. All right. So we're switching gears, but listen, this is priority of care. What do you know about it? How do you establish yourself as a safe nurse? Let's look at one more question. Let's add some pharmacology to this. And let's see here. A client with a history of transient ischemic attacks would be prescribed which of the following medications? So would you think that it would be number 1, furosemide? Do you know what furosemide is? Would it be 2, amiodarone? Would it be 3, aspirin? Or would it be that medication, metoclopramide? Which medication would you expect to be directly related to the treatment of TIA? Okay. And that correct answer, everybody should be saying yes, is number 3, aspirin. Aspirin, low dose aspirin therapy. So important for the cardiac patient. Number 4 is one of my favorite questions. It's a select all that apply. So that means that one can be right or all of them can be right. All right. So one can be right or all of them. So number 4 says this: which of the following statements indicate a client is being neglected? And this says select all that apply here. So number 1, my son takes me to the bank to deposit my money. Okay. 2, my son forgets to give me my insulin with meals. 3, my son cooks food for me that I don't always enjoy. Or 4, my son does not take me to see my physical therapist. How about 5? I often forget when my son comes to visit me. All right. So here we are talking about neglect. And remember, neglect means getting something. Neglect means when you don't get something that you need. It's when you don't get something that you need. So the correct answers would be 2, my son forgets to give me my insulin. You need that. The client needs that with meals. And also, my son does not take me to see my physical therapist. And so if we look at the choices again, let's look at the ones that weren't chosen. My son takes me to the bank to deposit my money. No sign of neglect there. All right. And then 3 says, my son cooks food for me that I don't always enjoy. And this one makes me laugh because I think about how many kids would say that about their parents. My kids would probably say that about me. I don't always cook food that they like, but they have to eat it as long as they're eating, right? So that's not a sign of neglect. And then 5, I often forget when my son comes to visit me. Again, this does not indicate neglect. The client may just forget. Okay, we're rolling on. I love doing these practice questions with you guys. They really make us think, don't they? They really make us think. Question number 5. A nurse is caring for Mr. Reed, who is prepared for surgery. When reviewing the chart, the nurse finds no consent form. What is the initial action to take? All right, this is interesting. Is it number 1, stop the surgery process? Is it number 2, have the client sign a consent form? Is it number 3, contact the physician? Or is it number 4, contact the nurse manager? Okay, so a client is prepared for surgery. The nurse is going over the final checkpoint, the chart, and she doesn't see a consent form. What should she do first? The most appropriate thing for that nurse to do is going to be to contact the healthcare provider. All right, and the reason why this is most appropriate is because it is the solution to the issue. All right, because again, the issue is there's no consent form. And so when you guys get into that virtual trainer and we talk about the legal aspects of nursing, you'll understand that it is the doctor's job to get that consent form, not the nurse's. All right. So there's no need for the nurse to have the client sign a consent form. And you definitely don't contact the nurse manager. The nurse manager is going to say, that's your patient. You handle it. All right. You notify that doctor. And so that's why 3 is going to be the correct answer. If you chose number 1, stop the surgery process, a lot of my students do typically tend to go with this one. However, remember, when you stop the surgery process, that means that the patient no longer is on their way to the surgical procedure. For example, if the client is in PO before surgery, right? If the client can't eat anything before surgery, if you stop that surgery process, then that means you let the client eat. That means you don't give the preoperative medications. You stop the surgery process. And registered nurses in general, we don't have the ability to do that. So the best thing to do is to contact the healthcare provider. Yes. All right. Let's do another question. The question is this. A nurse is caring for a client diagnosed with a deep vein thrombosis of the right leg and swollen toes. What is the initial action of the nurse? So is it notify the physician, check the client's oxygenation saturation, assess the distal pulses, or apply ice to the right leg? Oh, what sayeth you guys here? All right. The correct answer for the nurse to do is to assess the distal pulses. Absolutely. Because this is what it is, guys. All right. You already know that the client has a diagnosis of what? We know there's a DVT. We know that. All right. So what should the nurse do? We're not going to, hey, do we need to call the doctor and say, hey, the right leg and toes are swollen? No, we don't, because we already have the diagnosis. All right. The oxygenation saturation, that's not important. The patient has a DVT. We need to know, are there pulses? Okay. Are there pulses to that? All their pulses to that leg? Okay. Let's do one more question here. And this is just to get us in the mind frame of preparing for this exam. All right. How much content do we know? This is another one. Question number 7 is this. Which of the following clients is at risk for a sexually transmitted disease? All right. And again, this is a select all that apply. This is a select all that apply. So is it number 1? You have a 20-year-old client who is not sexually active, but in a long-term relationship. 2, an 18-year-old client who is sexually active, but has one partner and uses a condom. 3, a 22-year-old client in a long-term relationship, sexually active, addicted to heroin, and uses a condom. 4, a 21-year-old client with multiple sexual partners and uses a condom. Or 5, a 20-year-old client with multiple sexual partners and is on the birth control pill. Oh my goodness, all of these clients now, who is at risk? And I hope you guys got this one right. This is very basic safety. All right. The correct answer is everybody except for number 1. Yes. So 2, 3, 4, 5, everybody is at risk. All right. And let me tell you why. And I should add, we'll just talk about it. Okay. So number 1, let me just go back to this one. So to be at risk for a sexually transmitted disease, you have to be what? You have to be sexually active. That's it. If you're sexually active in any way, you're at risk. So the 20-year-old client, they're not sexually active. So are they at risk? No, they're not. So let's look at 2. 2 is one of our correct answers. And it gets me. It gets me when students leave this one out because it's full of distractors. So absolutely. But then I threw in the distractor and I said, well, the client only has one partner and they use a condom. And so most students are like, oh yeah, well, that takes care of all of their problems. And this patient is not sexually at risk for a disease. But are there STDs that you can get with a condom? Yes, there's so many, right? You can get lice, you can get herpes. We can go on and on, right? And even if the partner only has one partner, how many partners does the partner have? So even if the client only has one partner, we don't know what that other partner is doing. We have no idea. And so indeed, this patient is at risk for STD. You have to be able to catch these ones, all right? Because if you get one wrong, you get the whole question wrong. So 3, of course, this client is in a long-term relationship, sexually active. They're addicted to heroin, but they use a condom. And so we see that condoms are not the solution for STDs at all. And then so 4, 21-year-old with multiple sexual partners and uses a condom here, also at risk. And then 5, 20-year-old, multiple sexual partners and is on the birth control pill. So they don't even have a barrier solution. So these clients are all at risk for the sexually transmitted disease. Oh my goodness. Listen, this is what it's like, okay? This is what you need to do to study. It's not about just doing 100 questions a day or anything like that. It's about really taking your time, diving deep into this information, having fun with it, because this is your career, and demonstrating that you are competent. I have some other tips to help you stay on track when studying for Nclex, but I hope that you choose to study with ReMar Review. Here's my first one. Can questions be fun? Absolutely. But you know what? They won't teach you a thing if you don't study. If you don't study that content, just like we did today. We looked at diabetes mellitus in detail. We talked about the signs. We talked about the treatments, right? The medications. And then we did questions. And that is how you have to study. All right. But you don't have to do it alone. That's why I'm here. Let me take you through all of the topics on the test plan so that you're prepared. All right. Another thing that I want to say to my international nurses too is that, you know, confidence is key. If you don't think you can pass, you won't pass. And you have to understand that, is the exam difficult? Absolutely. The test is hard, but there are so many international nurses who are passing every day. You are no different. You can, you will, you must pass this test. And if you believe in yourself, that is the biggest hurdle to get over. The rest of the things will follow. You can do this. All right. You absolutely can do this. My third tip is forget about the real world. Please remember, Nclex is a totally different world. It's perfect here. You have everything you need. All right. Don't do what you see at your local hospital. Even some of the things you were probably taught, I don't know, but you have to do it by the book. You have to do it by the book. And that's why that test plan is so important. Another thing that my students mostly deal with, and it really doesn't matter, is just anxiety. And so test taking anxiety is a real thing. It is a real thing. You feel it, right? You feel the anxiety, you feel it in your body, and you get nervous and you get shaky. And what I hate to see is students who have anxiety so much that it paralyzes them, and they're afraid to move. They're afraid to test. They're afraid to take the chance. And so what I'm telling you is you have that anxiety, but let's for the good. And the way we do that is just to think in our minds, I'm uncomfortable. When I feel the test taking anxiety, I'm uncomfortable. And so I want to do what I need to do to get over this point. I don't want to have this anxiety. I know people who literally have been studying for Nclex for years, for 5 years, for 6 years. Can you imagine living with anxiety about Nclex for 6 years? I don't want you to do that. So when you think about the exam and you get anxious, I want you to say, okay, I'm ready to move on with this. I want to do it. I want to get it over with. I want to have the license. And so we want to have the anxiety as a motivator to the next step. All right. Another thing about studying for Nclex is there is a lot to know, but you have to have a realistic study schedule. And for me, I tell my students, you should not be studying more than 3 hours a day. You should not be studying more than 3 hours a day. You need to give yourself rest days. You know, you study a day, you take a day off. If you follow my study schedule, I literally have you studying 4 days a week. Okay, that's it, because you have a life. And if you're like me, you have kids, you're a mom, you're a wife, you have a job. You have to make this realistic so that you can stick to it. One more thing that I want to say is that it's important for you to understand that anything you do worthwhile is an investment. And so you need to prioritize the investment. You need to prioritize the investment. And that's the investment in yourself. That is the investment in the products, in the process, in the paperwork, in the license, whatever it takes, because I'm here to tell you guys that once you get your nursing license, it's oh so good on the other side. And everything that you have invested will come back to you double and triple over. I'm telling you. And I'm not just speaking for myself. You can ask any nurse that the small time that you spend struggling rewards you a lifetime of the career, the finances, everything that you need to take your family, take yourself to the next level is on the other side of the investment. So you are worth the investment. We invest so much in other things, in our clothes, in our entertainment, in our homes, in our cars, but nothing is greater than yourself. Your investment into yourself yields you the biggest reward. And so you can't forget about that. You know what, you guys, this has been a fantastic class for me. I have had a great time, and I don't want it to end, but we have to. So we just have a little bit more. I have another special message before I close the class with you guys. Check this out.
If you've already passed the Nclex exam, please email a copy of your resume to our recruitment team at recruiting@healthstaff.org, and one of our experienced recruiters will respond to you very quickly. We hope that you enjoyed Regina's teaching today. This is just a very small preview of the quality content and materials that you will receive as part of the ReMar virtual review package. Even if you have not yet passed Nclex, the health staff team would like to hear from you.
We're going to be able to provide you ongoing, very valuable information in subjects such as immigration, board of nursing, licensure, and even future job opportunities that we're getting every day. We have been able to provide more opportunities to nurses than all of our competitors combined. With our 22 years of experience and our reputation for integrity and professionalism, we're going to be able to provide you that peace of mind to know that your future will be secure.
We urge you to take advantage of the outstanding offer presented today. You can register now at the web address on the screen. We can help you with your Nclex application process so that you can get started on your journey to the US without delay. Your future is whatever you would like it to be, but it does start with you. The health staff and ReMar teams are cheering for you. You can do it.
That's right. Mr. Ron said it for us. You guys are part of the family now, so we want to really help make this thing easy. With the virtual trainer, you get not only the reduced price on the full package, right? The reduced international shipping, and you guys get twice the study time through this company. And so it's amazing. The direct hire placement. What more can you ask for? This is what we do here. It's all about you. It's all about making your dreams come true. We just want to see you happy. So with the virtual trainer, again, you get instant access to your account. It's your time. What are you waiting for? Have that success. And like I said, when I help a nursing student, there is nothing that is a bigger reward for me than to get those emails that say, hey, I am a USRN, because it literally is life-changing, but you got to take the step. We're here to help you. We have our arms extended. We put on this whole production just for you. So don't let this opportunity go by. I don't know of any other company that's doing this. And so I'm just so grateful to be a part of this family and to help you guys. Consider me your mentor, your Nclex instructor. No matter where you are in the world, we can make it happen. Your success, hey, for international nurses, this is what we do. The #1 direct hire and #1 training resource for Nclex, partnered together, all for you guys. Thank you so much. It was a pleasure. It was such a pleasure spending time, but I want to see you in the virtual trainer. So get in there so we can pick up where we left off. There is much to learn, but at the end of the day, we always say this here for our international nurses. We say, I can, I will, I must pass Nclex. Can you say that with me? I can, I will, I must pass Nclex. One more time like you mean it. I can, I will, I must pass Nclex. And so if you believe that, then it will happen for you. I'll see you guys in the virtual trainer. Bye-bye.